Have you looked at your feet today? Really looked? Because what I'm about to tell you might surprise you. Your feet could be quietly signaling a serious problem long before you ever feel it somewhere else. If you care about your health and want to stay ahead of hidden risks, take a moment to like this video and subscribe. I'm here to help you notice the things most people miss until it's too late. Now let me speak to you not just as a doctor, but as someone who has seen this happen too many times. People come into my clinic thinking their fatigue, their thirst, or their occasional dizziness is just part of getting older. They don't expect the real clues to be much lower, literally at their feet. And by the time they notice something is wrong, their body has been trying to warn them for months, sometimes years. Most people don't realize this, but your feet are one of the first places where subtle changes in blood sugar can begin to show. Why? Because the nerves and blood vessels in your feet are incredibly delicate. Even small imbalances can affect them early. And here's the part that concerns me the most. These early warning signs are often painless. That means they're easy to ignore, easy to dismiss, easy to overlook while life goes on as usual. You might think, if something was seriously wrong, I would feel it. But that's not always how the body works. In fact, some of the most important signals are the quietest ones. I've had patients tell me, I noticed something strange with my feet, but I didn't think it mattered. And that moment, that small, dismissed detail, sometimes becomes the turning point they wish they had paid attention to sooner. So as you listen, I want you to stay present. Think about your own body, your own daily experiences, because what I'm about to share isn't meant to scare you. It's meant to empower you. Your body is always communicating with you. The question is, are you noticing the signs? Have you looked at your feet today? Really looked? Because what I'm about to tell you might surprise you. Your feet could be quietly signaling a serious problem long before you ever feel it somewhere else. If you care about your health and want to stay ahead of hidden risks, take a moment to like this video and subscribe. I'm here to help you notice the things most people miss until it's too late. Now, let me speak to you not just as a doctor, but as someone who has seen this happen too many times. People come into my clinic thinking their fatigue, their thirst, or their occasional dizziness is just part of getting older. They don't expect the real clues to be much lower, literally at their feet. And by the time they notice something is wrong, their body has been trying to warn them for months, sometimes years. Most people don't realize this, but your feet are one of the first places where subtle changes in blood sugar can begin to show. Why? Because the nerves and blood vessels in your feet are incredibly delicate. Even small imbalances can affect them early. And here's the part that concerns me the most. These early warning signs are often painless. That means they're easy to ignore, easy to dismiss, easy to overlook while life goes on as usual. You might think, if something was seriously wrong, I would feel it. But that's not always how the body works. In fact, some of the most important signals are the quietest ones. I've had patients tell me, I noticed something strange with my feet, but I didn't think it mattered. And that moment, that small, dismissed detail, sometimes becomes the turning point they wish they had paid attention to sooner. So as you listen, I want you to stay present. Think about your own body, your own daily experiences, because what I'm about to share isn't meant to scare you. It's meant to empower you. Your body is always communicating with you. The question is, are you noticing the signs? Now, there's another sign I want you to think about, and this one often gets mistaken for something completely harmless: dry, cracked skin on your feet. At first, it may seem like a simple cosmetic issue. Maybe your heels look rough. Maybe the skin feels tighter than usual, or you notice small cracks forming, especially around the edges. You might assume it's just the weather, aging skin, or not using enough moisturizer. But most people don't realize this can sometimes be your body signaling something deeper. You see, healthy circulation plays a major role in keeping your skin nourished and resilient. When blood flow is slightly reduced over time, which can happen when blood sugar levels are not well balanced, the skin may not receive the hydration and nutrients it needs to repair itself properly. What I'm about to tell you might surprise you. Even mild changes in circulation can show up first in the feet, long before you notice them anywhere else. I've had patients who told me they tried every lotion, every home remedy, every cream, but nothing seemed to fully resolve the dryness. That's often the clue. When something doesn't respond the way it normally should, it's worth asking why. And here's where it becomes more than just dry skin. Small cracks in the skin, especially around the heels, can create openings. Openings that, over time, may allow bacteria to enter. In someone with stable healing and good circulation, this may not be a major concern. But if the body's repair systems are under strain, those tiny cracks can take longer to heal. I've seen situations where something as minor as a small crack turned into a lingering issue simply because it was overlooked. This isn't about assuming the worst. Dry skin alone doesn't mean you have a serious condition, but when it's persistent, worsening, or paired with other subtle changes, it becomes part of a bigger picture. Your feet are incredibly good at revealing patterns that often go unnoticed because each symptom on its own seems insignificant. So if you've been dealing with dryness that doesn't improve or cracks that keep coming back, take a moment to consider it as a message, not just a nuisance, because sometimes the smallest details are the ones that matter most. There's another sign I want you to pay very close attention to, and this one often goes completely unnoticed until it becomes difficult to ignore. Changes in the color of your feet. Now, I don't mean dramatic changes overnight. I'm talking about subtle shifts. Maybe your feet look slightly darker than usual, or perhaps they appear more pale, even when the rest of your body looks normal. Some people notice a faint reddish or bluish tint, especially when sitting or lying down for a while. Most people don't realize how important this is. Your skin color is closely tied to blood flow and oxygen delivery. When circulation is working the way it should, your skin tends to have a consistent, healthy tone. But when something begins to interfere with that flow, even slightly, your body may start to show it through these small visual changes. What I'm about to tell you might surprise you. Your feet are often one of the first places where these circulation-related changes become visible. I've seen this happen too many times. Someone notices their feet look a little off, but they assume it's just lighting, temperature, or even fatigue. They ignore it because it doesn't hurt. It doesn't stop them from walking. It doesn't seem urgent. But sometimes that subtle discoloration is your body's way of saying something isn't quite right. When blood sugar levels remain elevated over time, it can affect the health of blood vessels. This doesn't happen overnight. It's gradual, quiet, easy to miss, but the effects can begin to show in the smallest vessels first, especially those in your feet. You might also notice that your feet take longer to return to their normal color after pressure is applied, or that they look different at the end of the day compared to the morning. These are the kinds of details many people overlook. And I understand why. Life is busy. We don't spend much time analyzing our feet. But in medicine, these subtle observations can provide valuable insight into what's happening beneath the surface. This isn't about jumping to conclusions. It's about becoming more aware. If you've noticed ongoing or unusual changes in the color of your feet, especially when combined with other symptoms we've talked about, it may be worth discussing with a healthcare professional, because your body rarely sends just one signal. It sends patterns. And the sooner you begin to recognize those patterns, the better you can respond to them. Let me share another sign that many people overlook because it doesn't seem serious at first. Wounds or sores on the feet that take longer than expected to heal. You might notice a small cut, a blister from a new pair of shoes, maybe even a tiny scrape you don't remember getting. Normally, your body does an incredible job of repairing itself. Within days, you expect to see improvement. But what I'm about to tell you might surprise you. If healing seems unusually slow, if that small wound lingers for weeks instead of days, your body may be struggling in ways that aren't immediately obvious. I've seen this happen too many times. A patient tells me, "It's just a small cut. I thought it would go away." But weeks later, it's still there. Maybe slightly better, maybe not. And that delay is often the clue. Most people don't realize that stable blood sugar levels play an important role in how efficiently your body heals. When those levels are consistently higher than they should be, it can affect circulation, immune response, and tissue repair. That means even minor injuries may take longer to close and recover. Now, this doesn't mean every slow healing cut is something serious. There are many factors involved: age, nutrition, footwear, even how often the area is irritated. But when you start noticing a pattern, that's when it matters. You might also notice that the area around a wound looks slightly different, perhaps a bit darker or slower to form new skin. Sometimes there's no pain at all, which can make it even easier to ignore. And that's what concerns me the most, because when something doesn't hurt, we tend to assume it's not urgent. But in reality, painless issues can sometimes be the ones that quietly progress in the background. I remember a patient who told me they kept covering a small sore with a bandage, expecting it to heal on its own. By the time they came in, it required much more attention than it would have earlier. That's why awareness is so important. If you notice that your feet aren't healing the way they used to, don't ignore it. It doesn't mean something severe is happening, but it does mean your body may need support and a closer look, because healing is one of the clearest signals of how well your body is functioning beneath the surface. There's another sign that often confuses people because it feels so ordinary, yet it can carry more meaning than most realize. Cold feet. Now, you might be thinking, "My feet are always cold. That's just how I am." And for some people, that may be true. Temperature sensitivity can vary from person to person. But what I'm about to tell you might surprise you. If your feet frequently feel colder than the rest of your body, especially in normal room temperatures, it can sometimes be linked to changes in circulation. You see, your body prioritizes blood flow to vital organs first. When circulation isn't as efficient as it should be, the extremities, like your feet, may receive less warmth. Over time, this can create a persistent feeling of coldness that doesn't easily go away. Most people don't realize that this isn't always just about the weather. I've seen patients wearing thick socks, even in mild conditions, because their feet never seem to warm up. They assume it's just poor circulation due to age. And while age can play a role, it's not always the full picture. When blood sugar levels remain higher than normal over long periods, it can affect the health of blood vessels. This may reduce how effectively blood reaches the smallest areas of your body, including your feet. And here's something important. This change can happen gradually, so gradually that you adapt to it without even realizing. What once felt a little cold becomes your new normal, but your body remembers what normal is supposed to feel like. Sometimes, people also describe a strange combination: cold feet on the outside, but with occasional burning or discomfort inside. That contrast can be especially confusing, and it's often overlooked. I've seen this happen too many times. People ignore the signal because it doesn't seem urgent. It's not painful enough. It's not disruptive enough. But when you start connecting the dots, coldness, tingling, slow healing, skin changes, you begin to see a pattern forming, and patterns matter. This isn't about assuming the worst. It's about paying attention to consistency. If your feet are persistently cold without a clear reason, especially alongside other subtle changes, it may be worth looking into, because your body doesn't randomly send signals. Even the quiet ones are there for a reason. There's one more sign I want you to understand, and in many ways, it's the most important of all, because it's the one people notice the least. A loss of sensation. Not complete numbness all at once, but a gradual dulling of feeling. You might notice that your feet don't respond the way they used to. The ground feels different, textures feel less defined, even small injuries can go completely unnoticed. What I'm about to tell you might surprise you. This change often happens so slowly that people don't realize it's happening at all. It's not like flipping a switch, it's more like a dimmer, gradually lowering over time. Most people don't realize that by the time they clearly notice numbness, their body may have been adapting to reduced sensation for quite a while. I've seen this happen too many times. Someone comes in and says, "I didn't feel anything when I stepped on that." Or they discover a blister, a bruise, or even a small wound, and they have no idea how it got there. That's the part that concerns me the most, because pain, as uncomfortable as it is, serves a purpose. It protects you. It alerts you. When sensation is reduced, that protective system becomes weaker. And when you combine that with slower healing or changes in circulation, even minor issues can become more complicated over time. But I want to be very clear with you. This isn't about fear. It's about awareness and timing. If you recognize these signs early, tingling, dryness, color changes, slow healing, coldness, and now reduced sensation, you give yourself the opportunity to act sooner rather than later. I've had patients who caught these signals early, made small but meaningful changes, and worked closely with their healthcare providers. And those early steps made a real difference in how things progressed. So here's what I want you to do. Take a moment today. Look at your feet. Pay attention to how they feel. Notice anything that seems different, even if it feels minor. Because your body speaks in patterns, not just symptoms. And the people who stay healthiest over time aren't the ones who never have problems. They're the ones who notice early, ask questions, and take action when it still matters most. If even one of these signs felt familiar to you, don't ignore it. Not out of fear, but out of respect for your own health. Because sometimes the smallest signals are the ones that matter the most.